Sleeping is one of the most important things we do for our bodies on a daily basis. We can't function without sleep. But 1 in 12 Americans suffer with not getting the right amount of sleep because of a condition called sleep apnea.
So sleep apnea is very interesting and very common, a lot more common than we know.
So what exactly is sleep apnea?
Put our food tube and our breathing tube next to each other, and it shares a flap of skin. Flap of skin is called the glottis. And the flap of skin, when you want to swallow, falls on the side of the breathing tube, so food goes in your stomach. And when you want to breathe, the flap of skin falls on the side of the food tube, so you put air in your lungs. You don't want to put air in your stomach or food in your lungs. Neither of those are good. When you're awake, your brain controls that flap of skin. When you want to swallow, you swallow. When you want to breathe, you breathe. But when you're asleep, that changes things, and you go into what I like to call a secondary coma mode, where your body shuts down. And everything's run by the muscles and run by the brain without your consciousness being involved. In some people, that flap of skin gets a little redundant, and instead of staying on the side of the food tube, it falls on the side of the breathing tube. When that happens, you stop breathing and you hold your breath. So with sleep apnea is not an oxygen problem, though oxygen helps. It's a carbon dioxide problem. As you hold your breath at night, because the glottis is on the side of the breathing tube and you're not breathing, your carbon dioxide level starts to rise. Carbon dioxide is very bad for the human body.
So what are the telltale signs that you do suffer from sleep apnea?
The brain is constantly monitoring your carbon dioxide levels. When your carbon dioxide level hits critical, your brain says, we should probably wake this guy up and make him breathe. And so the only way to do that is to increase pressure in your throat. Continuous positive airway pressure, CPAP, a lot of people know what that means. It's the machine that we use for sleep apnea if you have it. But you increase pressure in your throat. And the only way to do that is to snore. And so you fall asleep, you stop breathing, you wake up and you snore, but you don't wake up enough most of the time to be fully awake. You wake up just enough so your muscles start to work on their own, and you snore, the glottis falls on the side of the food tube, you start breathing again, and you start panting. And so many people will say, their spouses say that you're all over the place at night. You're snoring, and then you're panting, and then you stop breathing. If you get that message from your spouse, you should get a sleep study. You should have a sleep study because you probably have sleep apnea.
How does a sleep study work?
The good news is the sleep studies are much easier to do now. We do them at home. You no longer do you have to go to a lab, and it's an easy test to do, so you don't have to go away. So if you do go to your doctor, ask them about a home sleep study versus an in-lab sleep study.
So now, what treatment is available for those that do have sleep apnea?
Let's say you have sleep apnea, you've been diagnosed with it, and you go to a sleep specialist, and they give you a CPAP machine. And those machines for people, and many people out there using them, and I would guarantee that everybody listening knows someone who has a CPAP machine. They come in various different forms, different sizes, and the masks are also really important. Remember, we're trying to blow normal air into your lungs at a certain pressure so that the glottis stays on the side of the food tube, to remind the glottis to stay on the side of the food tube. That's how it works. And so continuous positive airway pressure, it's pushing normal air. It's not oxygen. A lot of people always ask me that. It's normal air. I always say it's like a fish tank pump, but it blows at a much higher rate. That blowing into your lungs at a certain speed so that your brain and your glottis remind your body to breathe normally, and so that's how the CPAP machine works. But we can do that through little nasal pillows. We can do that through a mask, depending on the type of sleep apnea you have. That will be and how comfortable you are with it. But treating sleep apnea is very important because there have been studies that have shown that if you have sleep apnea, it's a precursor to hypertension, diabetes, heart disease, acid reflux, tiredness, lethargy, and many other issues, depression, anxiety. Sleep apnea plays a factor in. So treating the sleep apnea won't cure you of everything, but it'll definitely help.
To learn more about how to control and determine sleep apnea, visit toplinemd.com. Plus, if you don't have a primary care physician, all of the affiliated doctors' information can also be found on that page. The Topline MD Alliance consists of a group of top-of-the-line medical physicians and care teams who are committed to an exceptional patient experience while helping them to coordinate their care.